For women who are struggling with postpartum depression, don't be afraid to ask for help. If something doesn't feel right, if you don't feel right, there's no harm in that. Postpartum depression can present as sad mood, really a lot of irritability, having a hard time bonding with their babies, lack of interest in things, really feeling like you're doing everything you can to take care of yourself, to take care of your family, take care of your baby, and then feeling like it's not enough.
Women that have postpartum blues are usually able to function. Postpartum depression is usually more severe and it's more persistent. So it can take longer and it can really affect their ability to bond with the baby and take care of the baby's needs.
After delivering a baby, women are particularly vulnerable to developing depression due to the rapid and dramatic fluctuation of the hormone levels.
Postpartum depression doesn't happen right after you have your baby. I mean, there's that whole year period where everybody's changing and growing. So it can happen at any point in that 12 months.
After the birth of my daughter, I went through a prolonged 2-year depressive episode, which may or may not still be affecting me. It goes up and down.
After having a baby, there are so many drastic changes to life and to your body and life as you once knew it. It often is missed that this is developing into a true depression, and there are lots of efforts now to screen women for postpartum depression at their OBGYNs, at the pediatricians, at the first early visits, because it is not as apparent to the person or the family members that this is truly a depression.
So postpartum depression is treated through a combination of psychotherapy and medication and group therapy, and sometimes family therapy.
Postpartum depression is treated using a class of medications that you would use to treat depression, such as selective serotonin reuptake inhibitors, or SSRIs. The treatment for postpartum depression would depend on whether a woman wants to breastfeed or not. There are a few medications within that class that are safer in breastfeeding than the others.
One of the challenges when you have postpartum depression is you feel like you're alone. So having a group of other women that are experiencing similar symptoms can be quite therapeutic.
I think the key thing is that there's no one way to be a mom and there's no one way to be a new parent. And I think all moms need to recognize that. And they're gonna have really great moments and really bad moments, and that's okay too, but not to hesitate to ask for help if the bad moments are outweighing the good.